You know that feeling when you have to pee, but there's something ominous about it? It's a little painful? Maybe you go to the bathroom and there's a slight burning sensation. Or maybe there's a little drop of blood mixed in with the pee. You get up and there's a dull ache spreading through your pelvis. Your mind races back to the last time you had sex. Did you pee right after? Did you wait too long? Did you leave your sweaty leggings on too long after the workout yesterday? Do you have a UTI? Okay, we're not actually doing a Halloween special here, but the feeling of realizing I might have a UTI is definitely as scary for me as the feeling like there might be a ghost in the house. Honestly, a ghost isn't gonna make me pee blood 20 times a day, so I would pick ghost if you gave me a choice. Today, I have a case study for you. A friend of mine who has a lot of experience with UTIs, and some experience with ghosts actually, but we're not gonna get into that in this episode. So what is actually hurting when you have a UTI? Why might you get them over and over and over again? How does our vaginal microbiome keep us safe from UTIs and other infections? And why am I just learning about the link between the vaginal microbiome and recurring UTIs now?
Really studied the female.
Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because we've never
Really studied the female.
Welcome back to CRAMPED, the podcast where I try to find answers to my and other people's questions about their period pain and other pain like UTIs. I'm your host, Kate Helen Downey. If you just found this podcast and you're listening to the most recent episode, you might want to start back from the beginning of season 1 to get the whole story of my death cramps, some of the history of women's healthcare, and the reasons why we've never really studied the female body, like the song says. Season 1 was when we had grant funding. And speaking of funding, if you would like to support the work that we're doing on this podcast, you can do that via our Patreon at patreon.com/cramped. When you're a Patreon member, you get access to bonus episodes, and you can join our Discord community, which is full of other crampers who are sharing their own experiences and information that's helped them. We're a bunch of research nerds in there, so there's a lot of studies getting sent back and forth. And as always, a quick reminder, I am not a doctor. This is not medical advice. Everything presented in Cramped is my own or other people's personal experiences. I am just a research nerd with a uterus and a microphone sharing what I've found. And today, I have found a whole lot of fascinating information about UTIs and the vaginal microbiome. And just a little disclosure here at the top, a vaginal microbiome testing company called DAY reached out to me and offered to send me a couple of tests and make one of their health providers available for a chat. Ever since we dipped a toe in the research about vaginal microbiomes affecting period pain, I have been dying to do a deeper dive and learn more about what's living inside my vagina. And when one of my best friends was telling me about the dozens of UTIs that she's had over the past couple years and how tired she is of going on antibiotics over and over and over again, I realized this could be a good opportunity to explore how the vaginal microbiome works with a real example. I did not receive any money from this company, nor is this episode an ad for them in any way. So let's meet our case study guest.
Hello, I am Diana McCory. I am Kate's friend.
Yeah, you're my
I'm
friend.
a writer. Yeah, I'm Kate's friend.
We've had this conversation many times, but you have been having a problem with UTIs, right?
Yes, fairly consistently my entire adult life. There would be years where I wouldn't get them at all. I don't know what was different during those years. Sometimes it seems to have something to do with sexual activity. A lot of the time it doesn't.
That's always the classic thing, right? Is that it's like you have to pee right after sex or you'll get a UTI.
I don't think I've ever had sex without peeing right afterwards because I'm so paranoid about it. It doesn't seem to respond to anything except antibiotics. I am currently in this pattern where I get a UTI, I get prescribed antibiotics, they work fairly quickly to relieve the symptoms, and then sometimes a week later, sometimes as soon as I'm off the antibiotics, like 24 hours later, sometimes a month later, I get another one. And they'll come in batches where I'll get 3 in a month or 3 in 2 months. And then I won't get them for months and months on end. It's not like the antibiotics don't work at all, but it feels like a temporary solution. Then it just recurs almost no matter what.
So walk me through, like, you think you might have a UTI. What does that feel like? What happens next?
First, you play the sort of, oh, please no game of, I think I just have to pee. I try to get ahead of it by just immediately starting to drink as much water as I possibly can, because that does help.
Yeah.
And I drink a crazy amount of water as is, because that's what I'm told will help prevent it. Mm-hmm. And I take cranberry supplements. Mm-hmm. And I take prebiotics and probiotics. It's like all of the shit that I take that isn't like my birth control is about preventing UTIs. But usually, yeah, it starts with a little bit of the urge to pee. But it's a little different from that. Once you get enough of them, you can kind of tell the difference. So then usually I figure out that it's a UTI when I go to the bathroom and I don't actually have to pee. And it just feels that way no matter what I do.
What are the other symptoms?
Yeah, it's burning. Sometimes I'll get some pelvic pain. I think a lot of people get lower back or like pain in their lower abdomen. I don't usually get that. Yeah. I will get radiating pain in my lower pelvic region. I get really hot, and sometimes I get a fever. If it's really bad, I'll get a fever. Yeah. And there'll be blood in the urine, which is always a good sign.
Right.
And then honestly, I have had so many of these that I text my gynecologist pretty much immediately. And he puts in a prescription for nitrofurantoin or Bactrim, and I take that for 5 days. And it usually works. Within 24 hours, it usually works. If I can't treat it, if I don't have anything to take, I basically either have to be like in a bathtub with hot water on it, which does help, or just sitting on the toilet, like drinking water and hoping it will pass through me quickly. I've literally had my laptop in the bathroom, just like, well, I have to get the work done and I can't leave the bathroom.
Does it clear up on its own if you can't get antibiotics?
It has a few times when it's very mild. Yeah. Not ever when it's been severe. I don't think I've ever had a really intense batch of symptoms and had it clear up on its own.
I had one once when I was assistant directing a theater show at Dartmouth College for some reason. So I was like in the middle of the woods in New Hampshire, busy schedule, sleeping in the dorms. And I knew I had a UTI, but when I get them, they usually clear up on their own. And so I was just like ignoring it and going about my business. And at a certain point, I realized I'm sweating. Everything hurts. Like, I think I have a fever.
Yeah, the sweat.
And I had to ask someone to drive me to a minute clinic.
Yeah.
Yeah, and to be like, I think I have a UTI, and I think I have a fever, and I had a fever of like 103.
Yeah, it can get really bad.
And they were like, if you hadn't come in like today, you would have had to go to the hospital with a kidney infection.
Right,
so that
which
sucked.
is the risk I'm always terrified of.
Yes,
yeah, it's
and
so intense. And it can get so intense so fast. Like, you can go from feeling like, I kind of this might be one of those, and then an hour later, you're just like, oh God, please text me back. Please, doctor, do something.
I want to pop in here with a quick 101 on UTIs, or urinary tract infections. Just in case somehow you've never had one, congrats. Or if a doctor has never actually gone into detail with you about what they are. I got this info from the Mayo Clinic's website. UTIs basically do what it says on the tin. It's an infection of your urinary tract. Most often, it's your urethra or the bladder, but the infection can also spread to your kidneys, which then can get really dicey and dangerous. UTIs are most often caused by E. coli from your digestive tract. And there's basically 2 ways that E. coli shows up. Either it gets into your bladder through something you ate or drank, or it travels from your anus to your urethra after you poop. Just one of the reasons why good wiping technique and clean underwear is so important. This is also why people with vaginas are much more likely to get UTIs than people with penises. The E. coli have a much shorter trip to make from the anus to the urethra when it's a vagina. And people with vaginas have much shorter urethras, which makes it easier for the infection to spread to the bladder. When it comes to UTIs, it's the same as with real estate. Location, location, location. The pain from a UTI is mostly coming from inflammation. If the bacteria and the infection are in your urethra, the urethra becomes swollen and sensitive from the immune response to the bacteria, and the urine hitting that tissue really hurts. If the infection is in your bladder, the inflammation there can make even a small amount of urine in there hurt really bad and trigger the sensation that you need to pee, which is why having a UTI can make you pee so much more often. Muscles in the bladder and the pelvic floor can also spasm due to all that irritation and pain, which causes more pain, and that pain might feel like period cramps or dull aches. Like with any pelvic pain, people who have become highly sensitized to pain in that area because of recurring infections, severe period pain, endometriosis, whatever, these people might feel the pain from UTIs more intensely than others, even if the infection is quote-unquote mild. For some people, UTIs are just annoying, and they go away by themselves if they stay hydrated and, don't do anything crazy. But for other people, they can completely upend their day-to-day life if they get one, especially if you just keep getting them all the time. And if you've experienced severe period pain, you will probably relate to Diana's frustration trying to get these recurring UTIs treated by her doctor.
My gynecologist has basically indicated that some women just get them all the time.
That's such a non-answer.
Well, there must be something you can do about that. Yeah. I did have a urologist that I went to years ago who just basically gave me a giant bottle of these antibiotics and was like, take one every time you have sex. And I was like, that doesn't sound like a good idea, but I'll do it. And I did it. And I was fairly sexually active at the time, so I was taking them fairly regularly. And I didn't get UTIs for a while. So I did think maybe it does have either something to do with sex or just being on antibiotics all the time prevents it from happening.
So yeah, the problem is that the first line treatment doesn't seem to be totally effective anymore, and you need a different approach. Yeah. Okay.
Totally.
The reason I wanted to have you be the guest for the vaginal microbiome episode is that I came across a study that was drawing the lines between vaginal microbiome and reoccurring infections, whether that's UTIs, BV or bacterial vaginosis, or other kinds of infections, and also how the vaginal microbiome can affect period pain. So I'm really fascinated with this. Let's do a little 101 for us on vaginal microbiomes. What are they? This is a study that you can find on the NIH website. It's called The Female Vaginal Microbiome in Health and Bacterial Vaginosis. And it's by Chen X Chen, who we had on the podcast for episode 4. And it was published in 2021. The first sentence of the introduction is, the human body is a holobiont.
Biont?
Uh-huh. And I was like, never seen that word before in my life. And I looked it up, and it just means an assemblage of a host and the many other species living in or around it, which together form a discrete ecological unit through symbiosis.
So what you're saying is my body is a wonderland.
Yeah, the human body is a holobiont, meaning like
it's just a world where
whole
people
world.
Live. Little tiny people.
Little tiny people living inside you, all in you, around you. We know we have the gut microbiome. We've all accepted that. There's bacterial colonies like all living in our different parts of our gut. If some of those bacteria die off or go away or get too populous, they cause all kinds of problems. I had SIBO, so I feel like I'm very aware of my gut microbiome. And yes, you can take antibiotics, but like then you're killing everybody and starting over from scratch. You're doing some genocides.
Just burning the village down instead of finding the serial killer within the village.
Exactly. And so there's so many other ways to support your gut microbiome and keep the serial killers from coming inside or... Yeah, finding them and killing them specifically.
I've been burning the village down over and over again.
Yeah. So our vaginas have a microbiome as well. We have communities, villages of different bacteria, fungi, spores, like all kinds of stuff that sounds really gross to be living in our vaginas. When the village is healthy, when things are going good, the majority population is a bacteria called lactobacillus. What's cool about lactobacillus is just by being alive, the way plants breathe out oxygen, lactobacillus produces antimicrobial compounds. So if you have all this lactobacillus living in your microbiome, it is keeping the serial killers out. It is like, just by nature, it is creating an environment that serial killers cannot survive in.
Cool. I want more of that.
Exactly. So you want that. But when lactobacillus are not around, when they have left town, if they have died off, if their village got burned down, other bacteria that are less good for you or straight up bad for you are able to thrive in the village. When it comes to UTIs, it's my understanding from reading these articles that there's nothing in the microbiome that's going to give you a UTI.
Okay.
If your microbiome is healthy, you have a strong defense against the things that usually cause UTIs. So if you have a lot of lactobacillus, if you get some E. coli in there, a small amount of E. coli wanders its way in, a drifter from out of town.
I am always fucking drifters from out of town. That might have something to do with it.
But if a little bit of E. coli gets into your vagina, into your urethra, that lactobacillus is naturally secreting these antimicrobial compounds that are going to get rid of the E. coli. So if you, quote unquote, healthy system, if you have enough lactobacillus.
The best offense is a good defense.
Exactly. It's like it doesn't even become a problem. It's just nipped in the bud. If something has happened and the lactobacillus has left town, that E. coli that gets in there is going to cause a lot of problems. And then, and because of the way antibiotics work, the antibiotics kill everybody.
Right. The good
and
guys,
so
the bad guys.
That leaves you open to even more bacterial invaders. No matter how hygienic you are, no matter how much you pee after sex, no matter how much you abstain from sex, your poop hole's next to your pee hole, and
it's
sometimes stuff's gonna their drifters are gonna come into town. So that microbiome like needs to be healthy in order to not get recurring infections of any kind, but also UTIs.
Yeah, no, I don't want to keep burning this village to the ground. It doesn't deserve that. Its people are kind. They're not all serial killers.
It might be interesting to find out if your vaginal microbiome is healthy, if you've got a good defense going, because I think that would be interesting information to bring to your gynecologist or your primary care doctor and just be like, look, I know it's not this, or I know this is a problem.
Totally. That would be very helpful. I feel like we're just going to do like a cutaway to this sad little medieval village where everybody's just dying of the plague.
Oh my god, that's so sad to think of a medieval village in my vagina where everyone's dying of the plague.
I was really hoping for Fern Gully, but now I'm imagining like 1300s.
Fern Gully feels better to imagine inside my vagina.
I would much rather Fern Gully's going on down there. And maybe right now it's Fern Gully when Hexus is like,
oh my god, you pulled that right out of I feel like I haven't seen that movie in years.
Fern Gully, I think I could recite the entire script from memory. It's so good.
We're going to take a quick break and we'll be right back.
Because we've never really studied the female body.
Welcome back to Cramped. We're talking with Diana about her recurring UTIs and how learning what's up with her vaginal microbiome might give us some info about what's happening there, why she's getting these UTIs over and over again. And just a quick note, the microbiome testing company has asked me to be very clear. These tests do not test for UTIs or anything that directly causes UTIs. Okay, Diana, it's a couple of months since our last recording, a month and a half since
I don't
we
remember
recorded.
anything I said. Yeah.
Me neither. That's fine. We did our microbiome tests.
I did not realize that the entire test is just a tampon. That you
me neither. I was thinking
kind of
swab or something.
Me too. I thought it would be like a cotton swab. It's just a tampon. You keep it in for 30 minutes and then you're like, oh, wait, I got to take this out and mail it in, I guess.
Yeah, I got to mail my tampon, which, to be honest, is something I've always been like.
To the president.
Yeah. Let's talk results. Did anything surprise you?
I remember learning what lactobacilli? Bacillus?
Yeah, lactobacillus. Yes.
So I was like, oh, so I saw that word on the report and I was like, oh, I must not have enough of that. But apparently I have a high concentration of lactobacilli.
Congratulations.
It says it's in optimal range, but it also says high, which is like, maybe that's because I take probiotics all the time and I eat yogurt and I'm fucking obsessed with it a little bit.
Yeah,
right. So I didn't realize I was indirectly obsessed with my lactobacilli, and I guess I'm doing a good job at that. Everything else was not detected except Candida, which
Me
is
too.
Really,
Twins?
yeah.
I also had I was in the red zone for Candida.
Me too. It says detected out of normal range. So we got some Candida problems up in here.
We got Candida. Yeah. And have you been like, oh, that makes sense. I've been...
No.
Same.
I haven't had a yeast infection in, 10 years? More
Same.
than that? Maybe I've had it the whole time. Like, maybe I've just had one long yeast infection that I am not aware of.
I've like resisted looking up stuff about it because I'm like, oh, could this be causing symptoms that like are not clocking for me but are there?
Yeah.
I really want to be careful because like all of these kind of not clinical testing things, you run into the risk of paying too much attention where it's like, if it's not causing a problem, is it a problem? And I think that's what I want to learn. I don't want to like go on Monistat because this test showed me that I have a yeast infection, but I don't have any symptoms.
When you have no symptoms and you feel completely fine.
Right. And so I love being able to do a test and just see for myself, okay, what's going on in there? But then it's like the Apple Watch problem, right? Where it's like, do I need to be tracking my sleep?
Right.
Kind of obsessing unnecessarily or intervening unnecessarily. But I don't know. And that's something I want to ask the provider about. Do you have questions about your results that you want to ask the provider about?
I mean, the big one is just like, could this be connected to the UTI thing? Like, is this even remotely like in the same world of cause and effect? Or is this just like, oh, by the way, you also have a chronic yeast infection?
Right. We're going to go talk to the provider now. We hopped on a call with the provider that Day connected us to. Her name is Vienna.
I'm really happy to be here with you guys. Again, like I told you, Kate, I'm already a fan.
Oh,
just want to put that out there. Yeah. And I also want to clarify, I'm not a doctor. I am a holistic reproductive health practitioner. I've been working in women's reproductive health, fertility for 10 years now in different ways, but not a doctor.
Good. Me neither.
Okay, let's start with Diana's. So today, I think one of the things that's interesting about your results is your microbiome actually looks quite good.
Well, that's nice.
We're thinking, okay, like what, is there some kind of imbalance? And of course, this is a moment in time, right? We're looking at the vaginal microbiome. There's a lot of stuff in there. It's naturally very diverse. It should have some anaerobic bacteria. It should have some yeast. It might have those things in small quantities. That's perfectly fine. It's only an issue when those things get out of balance. And it's really dynamic, right? Our vaginal microbiome can heal, can change. This is like a cool thing about it. We tend to think like they're really static, and they aren't. Like they are capable of healing, and the microbiome is capable of changing. So in both good and bad ways. So with that, sometimes when we're trying to improve things, it really is just about bringing in balance versus doing a treatment. Sometimes treatment is necessary, and we'll talk about that. But sometimes it's simply just, okay, the lactobacilli are depleted. What can we do to rebalance the lactobacilli? And then it's their job to keep everything else at bay. So if we can give them the things they need to succeed, then our vaginas can succeed.
Right.
So looking at your results, your lactobacilli are great. Ideally, we want to see more than 80%. You're at 90. So that's amazing. All right. So all the probiotic stuff you're doing, even though you're taking antibiotics quite frequently or as needed, you're doing a great job with your vagina of keeping it like everything in good shape. So that's great. Good work.
Love that. Thank you. I'm going to get that soundbite and just play it for myself every so often.
Yeah.
I'm doing a great job with my vagina.
You're doing a great job with your vagina. Your anaerobic bacteria are at less than 1%, which we want to see less than 20%. So like you're absolutely in range for that. So anaerobic bacteria, there's a bunch of different kinds, but those as a group can cause things like BV. So when people have BV, it's usually an overgrowth of anaerobic bacteria. So bacterial vaginosis, that's what BV stands for. Really super common. I think if you have a vagina, you will have BV at least once. That can cause symptoms like itching, grayish discharge, bad smell. Like BV is one of the things we think of just like dead fish smell.
Oh, yeah.
Because it's some of those components.
Yeah.
It's really common. Okay, anaerobic bacteria, really low. Great. Your lactobacilli are doing a great job there.
Of them.
I'm going to skip to the mycoplasmas. These are also bacteria that can cause problems. So we test for Mycoplasma hominis and ureaplasmas. You're not detected at all. So these are bacteria that we expect to see in the vaginal microbiome. They're normal. They're supposed to be there. But what we don't want to see is elevated ranges of them. And when they're elevated, that can also cause symptoms that seem like BV, but it's actually not BV. And those two in particular, Mycoplasma hominis and ureaplasmas, can be real issues for fertility. An unbalanced microbiome in general is not beneficial for fertility, but we have some extra concerns with those two. That being said, if they're detected, it's not necessarily a cause for concern. But if it was out of range, if you were having symptoms, then we might talk about like treatments there. but they're also like resistant to antibiotics sometimes. So we want to be like careful how we treat those. But this is not a concern for you. Yours are not detected. So also a great sign.
And it's okay to not have them at all?
It's okay to not have them. Yeah. You might not have them at all. You might have them in low amounts.
Just very low.
Shift. Okay. Yeah. The one place we are out of range is with Candida. So Candida is yeast. Yeah, so it's a fungus. And so
love that. We love to hear that.
So with Candida, this is like a yeast infection. And what I've learned working with Day, they are primarily based in Europe. So they say thrush. So depending on where you are in the world.
That's the same thing. Oh, okay.
You'll say thrush, you'll say yeast, you'll say it's all Candida. Usually what's called Candida albicans. So that's like the most common species of this kind of fungus. So for you, yours is elevated. We want to see less than 10 to the 4th. Yours is 10 to the 6.7. So, little elevated.
Yikes. Yeah.
My question for you is, are you having any symptoms? Have you had a yeast infection before?
Yes, but it was probably 10 years ago, more than that even, maybe. I saw that and I was like, do I?
Keep in mind, like, it's not diagnostic. We'd have to do some other testing. But also, like, symptoms matter. You have this result, but if you're not having these other symptoms, that matters. So symptoms, we'll just review them. Itching on the vulva, an unpleasant kind of burning feeling, soreness, swelling of the external genitalia, so like the vulva, the labia, stuff like that. A whitish, yellowish discharge, like we always say, like cottage cheese, like chunky discharge. That's all classic with yeast.
I feel like I would know, right? Like,
I think you would. You could also experience painful sex with a yeast infection, so more like superficial, like at the vaginal entrance. The urethra can become inflamed, so peeing may hurt.
That's interesting. Okay, so that's like the UTI thing.
It could be. Do you remember having those symptoms when you did this test?
I didn't have those symptoms when I did this test.
Okay, great. That's great. This is where I sometimes will ask people other questions if they're like, I have chronic UTIs. Sometimes there's other things that can feel like a UTI, but is not a UTI. So for example, you could have a yeast infection. It could be related to an STD or STI. You could even pelvic floor dysfunction. So if you have a really tight pelvic floor, that can give symptoms that you have a UTI, but it's actually musculature. It's more of that.
That's interesting.
So that might, but the difference, of course, would be there. Like if you have an infection, if you did a test and it said, hey, like this is a UTI, then you have a UTI. I'm not in any way trying to say like you're making up that you have UTIs. That's not what I'm saying. It might be something to explore then, like maybe like working with a pelvic PT. I am definitely of the recommendation of go get an assessment. They can tailor more like appropriate exercises for you. I think sometimes we're under the impression that like the only options I have are like surgery or medication.
Right.
And I am a holistic provider, but I think as human beings, like everything is connected. So we're going back to what kind of brought you here, which is I want to understand what's happening with my microbiome. I'm going to look at my vaginal microbiome, and maybe that will tell me something about my bladder microbiome, which again, it's not the exact same testing. There are connections between all of our microbiomes. They don't exist in a vacuum. And even between the gut microbiome and the vaginal microbiome, we know those are very connected. So like wrapping this up, things are looking good. I would keep up with what you're doing. Your probiotics all seem to be like helping in terms of like your vagina. And then if you develop symptoms of that seem like yeasty, I would go see your doctor, do some testing, and then maybe take some action there. But like eating a good diet. There's also like some people will say it's a little bit controversial actually in so much as is there research beyond it, but like diet things. So like eating less sugar is seen as, or like reducing sugar consumption might disrupt yeast.
Yeah, that makes sense.
You will see people say different things on it. Generally it's like have a good diet, eat whole foods, right? Like all those things, vegetables, right? Yeah. But just something to consider.
I want to hear about Kate.
Yeah, let's talk about you. It's your turn. There are some similarities here. So looking at your lactobacilli, also amazing. You're doing a great job with your vagina.
I was actually really curious if that was going to come back because I just had surgery at the beginning of July, and I was like, I have no idea what knock-on effects there could be from that. So I'm really glad to see that the good guys are thriving.
They're doing great. Yeah. So lactobacilli look great. We love that. That's really important. Anaerobic bacteria, also very low, less than 1%. Again, we want to see less than 20%. Looking good there. Skipping again down to the mycoplasmas, the Mycoplasma hominis and the ureaplasmas not detected. Like I said, if they were there, unless they're within range, we're not really concerned if you're not having symptoms.
Once I'm finished recovering from surgery, I will be trying to conceive. And so that is an important issue for me.
Yeah, so let's talk about that.
Those are the two big things, though. I just had surgery at the beginning of July, and I am trying to conceive, not actively right this second, but we tried for about 9 months before getting the test that showed that I had a blocked and dilated fallopian tube, and that was causing the infertility, as well as probably most of my pain. We thought it was caused by endometriosis, but once they got in there and removed all the scar tissue and the fallopian tube, they were like, no, you have one tiny spot of endometriosis, and it was too far away from the fallopian tube to actually have caused the blocked fallopian tube. So all that scarring was due to some other infection at some point in your past, and it had to have been before I was 14, because that's when I got my first period and started having symptoms. So it's just a big mystery now. But the good news is I have a little bit of endometriosis, but not much. And so far I've had 3 periods since my surgery, and the first one was rough, but that's just because there was still so much inflammation from the surgery. And then the other 2 have been like normal and fine, and so that's very exciting. Yeah.
Great. Okay, so they removed one of your fallopian tubes.
Yes.
Okay, great. And then they removed like a few adhesions, one adhesion, I don't know.
So they removed, I think it was something like 7 or 8 different adhesions from different mostly around my ovaries. Both of my ovaries are fine. Uterus is fine. 1 fallopian tube down, but they were like, that only really reduces your fertility by 15% because they're ambidextrous. And then they removed my appendix. They tested them all for endometriosis, and only one of them came back positive. So they were like, yep, all that scarring's just from something else, ?
Oof, okay.
I know.
Well, at least it's out. At least it's out. We got it out.
Yeah, but it's like, what childhood pelvic infection did I have that was untreated and
really dramatic
and caused so much scarring? Yeah.
Yeah.
Crazy.
That's wild.
Yeah, I don't know the answer to that one. That is okay, but you're feeling much better.
Yeah. So much better. Yeah.
Okay, excellent. That's great. Your body's resilient, and you can heal, and you can go through big traumas, and you can have surgery, and then you can heal from it. And I think that's, again, something I always want to say about our bodies, but also the microbiome. Like, the vaginal microbiome is flexible and dynamic and can heal. So looking real good, except we have the same thing with the elevated candida, which is interesting. Yours is, again, we want to see less than 10 to the 4th, and yours is at 10 to 6.4. So I think it's just a little bit different than Diana's.
Wow.
So my question for you now is, are you having symptoms?
I don't think so. Like, I'm not having any itching. I'm not having any pain. I just learned in April how to cycle track, and so I've been cycle tracking my cervical mucus or cervical fluid, whatever the correct terminology is.
I say mucus, but yeah.
Yeah, but one thing that has been a low-level mystery for me is I do notice at certain times in my cycle I will have what I have thought is like cell slough. So it's almost like paper pulp. Like, it's not baseline. Oh my God, yeah, it's exactly that. Yeah.
Okay, yeah.
You just had that ready to go.
Like, I'm lots of stuff here.
But it's like a lot, but it's like a lot more than that. Like, it'll be like maybe 3 or 4 times more than that just from a check. And I've been like, ooh, is this like a yeast infection? Is this okay? But because of it's not like a cottage cheesy texture. It's like that kind of pulpy kind of texture. Yeah. And so I'm like, oh, I guess just certain times of my cycle, there's like a lot of cell slough going on. But now I'm wondering, like, oh, if I have all this yeast, is it actually yeast?
Yeah.
So it's a great question. And this gets into another area that I'm very passionate about, is like menstrual cycle charting. This is another area where we're not educated about what should be coming out of our vaginas, except for blood. Yeah. There are different like kinds of discharges that we'll experience. What you might notice, so as your estrogen levels start to rise, you might start to notice the production of a mix of cervical mucus and vaginal discharge, that's cell slough, right? So that white stuff is generally like a combination of skin cells, can be like a byproduct of the microbiome, things like that, mixed with cervical mucus. So you start to see it come out because it's all kind of being washed out or like flushed out. So that might be what you're seeing. If you're seeing it leading up to seeing clear stretchy mucus, or you're seeing it after for a couple of days, I wouldn't call that a concern.
Okay.
Some people see it right before they get their period. They'll have like an increase in that discharge. So this becomes a thing where it's like you're seeing a discharge, but you're not having symptoms, then I would not say that's a yeast infection. What I'll also say, yeast infections, pregnant women will get them really commonly because of like changes in estrogen. So this is conjecture, I can't tell you for sure, but you might be slightly predisposed. That's the word, to it during pregnancy. That is another reason why when we think about pH changes, right? People will throw around, my pH is off. That is a thing, but your pH will change naturally throughout your cycle. During menstruation, it's also like a higher pH, like it's more alkaline because blood is more alkaline, which is why sometimes people will start to have symptoms of different infections after menstruation because of that pH change. But also, if you're having unprotected sex with semen involved, it throws off your pH and your microbiome a little bit. So depending on how resilient your vaginal microbiome is, that can lead to other problems because you keep resetting the pH, which the lactobacilli don't like, and throws them off their game, and then that can cause other issues. Sometimes that happens when we're trying to get pregnant, right? Like you can start to get an increase in like vaginal things happening because all of a sudden you're being exposed to semen all the time. Again, like it's resilient. Your vagina like should rebound, right? It's not like semen is an unknown quantity for like human species, right? But things can happen.
We asked Vienna what we could do to take better care of our microbiomes, even though we're already doing a really good job.
One of the things you could do, or you could both potentially experiment with, is like a vaginal microbiome specific probiotic. There are different kinds of bacteria in our gut microbiome and our vaginal microbiome. And there are different strains that are more protective to the vagina. And they've done some clinical studies on it that show that the bacteria survive the digestive system. And so one of the ways we currently understand how the population happens is they do travel from the anus to the vagina. So taking oral probiotics for the vagina does work. So that could be something you could try. If you wanted to be like, all right, I do want to do one thing, you could try doing vaginal probiotics.
Okay.
Cool.
Yeah. It's good to have an option.
Yeah. Good job with the vaginas.
Yay!
We did a great job with our vaginas. I'm so proud of us.
I love getting a good grade in vaginas.
I learned so much.
Yeah. We thanked Vienna and then took a minute to chat, just Diana and I. I want to get our last thoughts on the UTI of it all and also the yeast of it all. Where's your head at UTI-wise right now?
The pelvic floor thing was actually really interesting as a potential cause for not necessarily UTIs, but the pain that I am always comparing to UTIs, because I definitely have that thing where I experience urinary pain and automatically think this must be a UTI. And sometimes I get tested for it and I don't have one.
Right.
And it has been kidney stones at least once, but it could also be some kind of pelvic floor issue that is a result of, I don't know, sex or tightness. I don't have pain during sex, but sometimes I have pain after sex, and like that could cause urinary pain as an offshoot of that. I never considered that.
And we've had conversations before about we both like massages that are so intense that they like hurt. And I think that relates to like just a state of tension generally that our muscles are usually in. That if we're both tending towards like muscle tension as a default, like probably your pelvic floor is pretty tight.
Yeah. I feel like I've done so much research on what could be causing this pain. And all the research I'd done usually led to what would be causing specifically a urinary tract infection, not urinary pain, not pain in your urethra, which is what it always is.
Pelvic floor physical therapists, in my experience and from other people I've talked to, tend to be like really good pelvic pain detectives. Where like you go to a doctor and they have 10 minutes with you and they really just need to be like, what medication do I need to prescribe you?
Do you want nitrofurantoin? And I'm like, yes, I guess.
Right. Fine. And then pelvic floor physical therapists are in the room with you for an hour. They're getting information about what your muscles feel like. They're getting information about what's going on with you, like emotionally, mentally, like all this other stuff.
Yeah.
And they very often can be the ones to be like, I think you should go see this specialist. I think you should go see somebody about this. Here's what I'm seeing. Here's what I'm feeling. Here's what I think might be going on. It's not my area of expertise, but I think you should check this out. And because they have so much time with you and so much expertise about the pelvis in general, they can really like get you going in the right direction. And so for you, that might mean like a functional medicine urologist or something, somebody who can troubleshoot more than your current doctors are doing.
Yeah, because they're not really doing it at all. They're just giving me antibiotics and telling me to get the fuck out of their office.
Or it could be you go to a pelvic floor physical therapist and they're like, yeah, you got a lot of stuff going on here.
Right.
No wonder it hurts when you pee. Yeah. Okay, and then what do you think about the yeast stuff? Like, I
don't know what to think about it. Honestly, my first gut reaction was, how dare you? I don't have a yeast infection. And like
that's
apparently
insulting.
Don't. Yeah, because it feels like something that I would know about and would be bad.
Like for it to be an infection, it has to be causing something, right?
Does it even constitute an infection if you have no symptoms whatsoever, which I don't think I do? Is it just, it's just a fact about...
Yeah.
But it's also, maybe it's just the fact about our vaginas this week.
it is just a snapshot of a specific period of time. Yeah, who
Right.
knows? But
Yeah.
no, that is really interesting.
Yeah, where was your head at about it?
I'm just really glad that it wasn't like, oh, go change all these things.
You've been through enough.
It's really refreshing to get a test result that could be worrying and to talk to someone who's like, is it affecting your
good.
quality of life? No? Then don't worry about it.
Right.
Here's some
Love that.
knowledge. Here's what you should do if you start getting symptoms. But if it's not a problem, don't make it a problem. I love that
Right.
approach. Love it.
Yes.
Yeah.
Yeah, we need more of that.
Yeah. And also that it is part of a healthy microbiome. And so the fact that it's higher, like, by itself doesn't necessarily mean anything. Because I think, again, about what Kate Clancy said, the biological anthropologist, who I quote all the time, who said the whole medical system's idea of normal is not based on the kinds of variety we see in menstrual cycles and in vaginas. Like, you can take an
Right.
average, but the average doesn't necessarily mean that the closer you are to the average, the healthier you
The
are.
more healthy you are.
Now, I don't know if that applies here, but
Right, but she did say it's a dynamic system. It's changing all the time, and that's part of what's normal.
yeah.
Fascinating. Wow. I learned a lot today.
Yeah, man, thank you for going on this journey with me and for being a guinea pig with me for microbiome
Thanks for inviting me to
testing.
be a guinea pig. Maybe if this stops UTIs from happening to me, I will buy you a car.
We're recording.
Hold me
so
to it.
I'm gonna
This
hold
is being
you.
recorded. It might be a shitty car I find in an impound lot, but it'll
That's
be
fine.
a car.
I'll take it.
Yeah.
As with pretty much everything that I've looked into and tried to find answers to, a problem that we're having, like, it's not a clear answer, right? It's not like a clear cut,
Right.
like, this is happening and this is the solution. It's more like there's whole areas of information I didn't even know were related to this.
Right. Yeah, but like with your issues, you were presented with this like really overwhelming amount of information, and the deeper you dug, the closer you got, and you might have actually solved the problem now.
The problem
never
may
know.
have turned out to be something that
Something
I didn't-
completely different.
something totally out of left field, but it was
Right.
only by pursuing one line
But
of
by
inquiry.
digging deeper and deeper and like
Right.
getting to the part where they actually go in there and look.
Yep.
Yeah. Yeah.
It's never a straight line, but it's at least you're going somewhere. For me, that's the biggest win, is like, as long as we can get unstuck and we can be going to new places, even if they're not the 100% right places, even if they're not like the answer to the question irrefutably forever, at least
Right.
we're not stuck at dunno.
And like in every investigation, there's going to be dead ends. There's going to be red herrings. It's like a detective story. I love it.
Right?
And eventually you find the murderer.
I love it.
Murderer of my vagina.
Okay, well, please keep me updated on the pelvic floor
will.
physical therapy stuff. If new things happen, maybe we'll do a mini update,
Little follow-up.
Yeah, and keep people updated on your story. I hope there's progress, and I hope you get more information.
Thank you. Thank you for caring about me and helping me.
Oh, of course. And that's it for this week's Cramped. If you have had an experience with recurring UTIs or the vaginal microbiome that you would like to share, we would love to hear it over on the Cramped Discord, which you can join by supporting us on Patreon at patreon.com/cramped. I absolutely welcome any corrections or further information. We are all just learning as best we can in this messed up world. So you can reach out to me on Instagram at Kate Helen Downey or email us at crampedpodcast@gmail.com. See you next time.
What's happening to your body? We don't know because we've never really studied the female body.